Part A. Extract 1. Questions 1 to 12. You hear a pharmacist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How can I help you today?
Oh, thank goodness. Good morning, Robert. I'm here because I'm really concerned about this swelling that just doesn't seem to go away. It's been really uncomfortable, and honestly, I'm starting to get worried. It's been lingering for days, and the pain, well, I guess it's more of an itching, burning feeling that's just getting worse.
I see. Could you describe exactly where the symptom is and what it feels like?
Absolutely. It started on my left forearm, near the wrist, and the area is really puffy and inflamed. Initially, I thought it might be a rash, but it's very localized, almost as if it's confined to this one spot. The skin around it feels unusually warm, and at times, it's a bit tender to the touch. But what's strange is that it doesn't look like a typical rash. There are no red spots, but it's noticeably swollen and even a bit shiny.
That does sound uncomfortable. How would you describe the symptoms?
It's a persistent kind of itching, almost like when you have a strong allergic reaction. And it's hard to explain. I feel like a stinging sensation, as though something is irritating the deeper layers of my skin, not just the surface. The itching comes in waves, but the stinging seems to be constant.
Okay, got it. So, has this spread or changed in any way since it first appeared?
Yes, actually. At first, I thought it was just a mosquito bite, so I ignored it. But then it started spreading slightly upwards toward the elbow.
Oh, I see.
And now it feels almost, I don't know, kind of hard? Like there's fluid building up beneath the skin. I'm also noticing that I feel slightly warmer than usual, almost feverish, though I haven't checked my temperature.
Understood, Mihiraa. Have you tried any treatments or remedies so far?
Oh yes. First, I used a basic hydrocortisone cream, thinking it would calm the itching. I also tried an ice pack to reduce the swelling, but neither seemed to have much effect. Then I took an antihistamine pill, diphenhydramine, to manage the itching, but it just made me feel sleepy without really reducing the symptoms. Finally, I applied some aloe vera gel, thinking it would soothe the irritation, but even that didn't help. At this point, I feel like I'm just trying anything I can think of.
I see. And Mihiraa, are you currently on any medications or managing any other health conditions?
Yes, I do take a low-dose aspirin daily for heart health as recommended by my GP. I also occasionally take ibuprofen for headaches, but I haven't taken any since this swelling started. Other than that, I'm on a mild prescription for hypothyroidism, levothyroxine, 50 micrograms every morning on an empty stomach. I've been taking that for over a year now without any issues. I'm careful with medications because of my thyroid.
That's helpful information, Mihiraa. Based on what you've described, it sounds like this could be an allergic reaction to an insect bite, possibly causing some localized inflammation and swelling. Sometimes these reactions can last a bit longer if the bite was from a specific type of insect or if there's a mild infection setting in.
Really? I hadn't even thought about that. But wouldn't the antihistamine have worked if it was just an allergy?
Not necessarily. Sometimes, the body's reaction can be stronger, and a topical corticosteroid might be needed to reduce the swelling effectively. I would suggest trying a mild corticosteroid cream, triamcinolone acetonide, which is stronger than the hydrocortisone you tried. You could apply it to the affected area twice daily.
Okay, so just apply it directly on the swelling?
Yes, exactly, Mihiraa.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How have you been feeling since your last visit?
Good morning, Marcus. Well, the pain's still there, especially in my lower back. It flares up when I try to bend or lift anything heavy. I'm also finding it quite hard to sit for extended periods. It just feels like there's this constant, dull ache that won't go away.
I see. That sounds uncomfortable, Mihiraa. Let's dig a little deeper. Has the pain changed in intensity since our last session, or has it remained fairly consistent?
It's actually a bit less intense than before, but the stiffness in my back is still limiting my movement quite a lot. Some days I feel like I just can't get comfortable, even when lying down. I'm worried that I'm not improving as fast as I'd hoped.
That's understandable, Mihiraa. Recovery from back pain can be slow, especially if there's muscle inflammation or nerve involvement. Let's review your treatment so far. You've been following the recommended exercises, right?
Yes, I've been doing the ones you showed me, the pelvic tilts and bridging exercises, 3 times a day as you suggested. I also do the knee to chest stretches in the mornings. They seem to help a little with flexibility, but they don't seem to alleviate the ache completely.
That's good to hear. Those exercises target the muscles in your lower back and core, which are essential for improving your spinal stability. Have you also been using the hot and cold therapy we discussed?
Yes, I alternate between a heating pad and ice packs about twice a day. The heat seems to relax the muscles, but the cold packs help reduce the soreness after I've been active.
Great. It sounds like you're sticking to the plan. Now, let's go over a bit of your history to see if anything might be contributing to this slow recovery.
Yes, I had a neck strain about 2 years ago. It did resolve, but I occasionally still feel tightness there, especially when I'm stressed. I also had a knee injury last year, but thankfully, that's fully healed now.
All right. Given this history, it's possible that your spine and core muscles may have been compensating for those previous injuries, which could be impacting your lower back now. Based on what you've described, it sounds like there's been some improvement in your range of motion, which we call enhanced lumbar mobility. But we'll need to evaluate your progress with a few more tests.
That makes sense. What kind of tests do you have in mind?
I'd like to perform a lumbar flexion test to assess your spine's forward bending capacity, as well as a straight leg raise test to determine if there's any nerve involvement. We may also consider a functional movement screen to observe your movement patterns in more detail.
Okay, that sounds helpful. Will we need to adjust my treatment based on the test results?
Possibly, yes. If we find that nerve involvement or excessive muscle tightness is a factor, Mihiraa, we might add some soft tissue mobilization and trigger point therapy to your sessions. I may also recommend you start with core stabilization exercises, like planks, in addition to the ones you're already doing. These will help build strength in the deeper abdominal muscles, which can provide better support for your spine.
All right, I'll give it a try. Is there anything I should avoid doing in the meantime?
Yes, avoid any heavy lifting, twisting movements, or prolonged sitting without breaks, as they can put additional strain on your lower back. Also, listen to your body. If you feel any sharp or shooting pain, stop the activity immediately.
Got it. I'll be careful.
That is the end of Part A.